ನಮಸ್ತೆ ಶುಭಮಂಗಳ ಮ್ಯಾಮ್.
ಮೇಡಮ್ ನಮಸ್ತೆ. ಅದು ಸರ್ ಇರ್ಲಿ ಕ್ಲಿನಿಕ್ ಅಲ್ಲೇ ಇದ್ರು ಮ್ಯಾಮ್, ಹಂಗಾಗಿ ಸ್ವಲ್ಪ ಆನ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಲೇಟ್ ಆಯ್ತು ಮ್ಯಾಮ್. ಮ್ಯೂಟ್ ಆಗಿದ್ದೀರಾ ಮೇಡಮ್? ಮ್ಯೂಟ್ ಆಗಿದ್ದೀರಾ?
ಇಲ್ಲ, ನಂದು ವಾಯ್ಸ್ ಕ್ವಾಲಿಟಿ ಸಡನ್ ಆಗಿ ಮೊಬೈಲ್ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ಬಿಟ್ಟಿದೆ. ನಾನು ಹಾಗೆ ಮನೆಗೆ ಹೋಗ್ತೀನಿ. ಮನೆಗೆ ಹೋಗಿ ಇಯರ್ಫೋನ್ ಮನೆಯಲ್ಲಿದೆ, ಮನೆಗೆ ಹೋಗಿ ಹಾಗೆ ಹಾಕೊಳ್ತೀನಿ. ನೀವು ಇನ್ನೊಂದು 2 ನಿಮಿಷ ವೇಟ್ ಮಾಡಿ, ಯು ಕ್ಯಾನ್ ಸ್ಟಾರ್ಟ್ ದ ಕ್ಲಾಸ್.
ಅದೇ ಅಷ್ಟರಲ್ಲಿ ನಾವು ಇದು ಮಾಡ್ಕೋಬಹುದು. PPT ಬೇಕಾದ್ರೆ ಒಂಚೂರು ಶೇರ್ ಮಾಡೋದು ಅದೆಲ್ಲ ಮಾಡ್ಕೊಳ್ಳೋಣ.
ನೀವು ಅದನ್ನ ಟ್ರೈ ಮಾಡಿ, ಖಂಡಿತ. ರೆಕಾರ್ಡಿಂಗ್ ಆಲ್ರೆಡಿ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ. ಎಸ್, ನೀವು ಅದನ್ನ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. ಮೀನ್ವೇಲ್ ಡಾಕ್ಟರ್ ಸಾವಿತ್ರಿ ಮೇಡಮ್, ನೀವು ಅದನ್ನ ಇದನ್ನ ಮಾಡ್ಕೊಳ್ಳಿ, ಏನಂದ್ರೆ ವೆಲ್ಕಮ್ ಎಲ್ಲ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಶುಭಮಂಗ್ ಡಾಕ್ಟರ್, ನೀವು ಅದೊಂದು ಟ್ರೈ ಮಾಡಿ ನೋಡಿ. ನಾನು ಮನೆಗೆ ಹೋಗಿ ಜಾಯ್ನ್ ಆಗ್ತೀನಿ, ಬಿಕಾಸ್ ನಾನು ಜಾಯ್ನ್ ಆಗಿರ್ತೀನಿ.
ಸರಿ ಸರಿ.
Yes madam, yes madam. Let me begin ma'am. ಓಂ ಶ್ರೀ ಧನ್ವಂತರೇ ನಮಃ. ಓಂ ಶ್ರೀ ಗುರುಭ್ಯೋ ನಮಃ. ಗುರು ಬ್ರಹ್ಮ ಗುರು ವಿಷ್ಣು ಗುರು ದೇವೋ ಮಹೇಶ್ವರಃ, ಗುರು ಸಾಕ್ಷಾತ್ ಪರಬ್ರಹ್ಮ ತಸ್ಮೈ ಶ್ರೀ ಗುರುವೇ ನಮಃ. In the name of Lord Shri Dhanvantari, today on the occasion of Guru Purnima, I bow my head in the holy feet of every guru who has taught me a single word, either it is offline or online. So let us begin. Let us welcome our most beloved, ever active, humble, good orator, Dr. Shubhamangala ma'am, to the platform to discuss the topic success stories in infertility. Before we begin, I humbly request all the participants to mute their gadgets until the session is complete by the speaker. And if any problem is in between, kindly check your network first, and if it is okay, then kindly inform us. So saying these few words, I hope there's no need to explain about Shubhamangala ma'am. She's a well-known personality in between us. So let me hand over the platform to Shubhamangala ma'am. Madam, welcome.
Thank you. Is it visible?
Yeah ma'am. Screen is not visible. Like
not visible. Wait a second.
Yeah. Yes ma'am, now it's visible.
Wait a second. Is it?
Yes ma'am.
Okay. So should we wait for 1 or 2 minutes for Dr. Shakuntala ma'am to join, or how do we proceed?
Yeah ma'am, it's let us wait for 2 more minutes ma'am. It's 9:10.
Yeah.
Let's wait till 9:12 ma'am. Hope
Yeah.
others will join.
Yeah, no problem. Okay.
Namaste, Shubhamangala ma'am.
Namaste.
I attended your ACHARYA webinar. It was wonderful.
Thank you.
ಅದು ತುಂಬಾ ಖುಷಿ ಆಗಿತ್ತು ಮೇಡಮ್. ನಮ್ ಕಡೆಯಿಂದ ಆಚಾರ್ಯ ರಸಾಯನದಲ್ಲಿ ಒಬ್ಬರದು ವೆಬಿನಾರ್ ಇದೆ ಅಂದ್ರೆ ದಟ್ ಈಸ್ ಗ್ರೇಟ್ ಹಾನರ್ ಫಾರ್ ಕರ್ನಾಟಕ ಆಲ್ಸೋ ಅನ್ಸ್ಕೊಂಡೆ ಅಂತ ಫೀಲ್ ಆಯ್ತು ನನ್ಗೆ.
ಥ್ಯಾಂಕ್ ಯು. ಏನಿಲ್ಲ, ಜಸ್ಟ್ ನಾನು ಶಾಸ್ತ್ರ ನಂಬೋದು, ಬೇರೆ ಗೊತ್ತಿಲ್ಲ, ಅಷ್ಟನ್ನೇ ಫಾಲೋ ಮಾಡ್ಕೊಂಡು ಹೋಗೋದು ಬ್ಲೈಂಡ್ ಆಗಿ ಅಷ್ಟೇ.
ಚೆನ್ನಾಗಿತ್ತು ಮೇಡಮ್, ಚೆನ್ನಾಗಿತ್ತು. ಓಕೆ.
ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದು ಅನ್ಸುತ್ತೆ.
ಮೇಡಮ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋದನ್ನ
ಸರಿ ಸರಿ
ನಿಮ್ಗೋಸ್ಕರ ವೇಟ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಮೇಡಮ್.
ಓಕೆ, ಶುರು ಮಾಡೋಣ. Thank you for considering me. I don't have any properly formed, detailed, whatever presentation. I was very busy with the other programs, so in between I added some slides, and I can at the end one case I have added, but I can share some more cases. Agadirogan Satana Shaktana Sheshakaya Pasutana Shetan Ausukya Moharatida Jakhana Yopurva Vaidyaya Namostu Tasme. So namaste to all the Vaidyas, Apurva Vaidyas joined here. And one of you, nothing great. I know many of you have done more than what I have done. So just that's what I do. I'll just explain. So Vandyatma, most of the time people come to me with like after 3 years, 4 years of marriage, without many of them it have like basic problems which are like metabolic problems like thyroid imbalance or irregular menstruation, such things. So I start treating that problem, and maybe some 1 or 2 tests I do. So I start from here, like Artava, whatever our text says, we have to see the Artava. More than seeing any report, we have to ask questions. I feel by asking questions, we'll get where the problem has started. As we know, we have to have Darshana Sparshana Prashneshata Pariksheta Charuginam. So as Acharya says, Shashastrik Pratimam Yatayat Lakshara Sopamam Tadartavam Prashansanti Yad Vaso Na Viranjayet. So it should not create any stain on the cloth. But nowadays it is very difficult to find out because nobody uses cloth. But I have seen few years ago, even my like my mother and her mother, they were talking about like suddenly the stain, the cloth has increased, so maybe something is wrong, so we have to take care. So they used to when that happens, they used to prepare this we have this hibiscus, like half-white hibiscus. They used to prepare some preparation in that, or some other home remedies they used to prepare. My mother's mother used to be she used to treat like village Vaidya kind of thing. So she used to advise, she used to ask this question. So tumba kale udiyutta, something like that. So that time we used to think, what is this stupidity? But once I started studying, I realized, so these are all important factors. We have to concentrate. The Arthava, from there we have to concentrate. This is mentioned in Sushruta second, Sharira second. And then Arthava Srotas. So here Arthava Hedve Tayor Mulam Garbhashaya Arthava Hinyashcha Damanya Tatra Vidhaya Vandyatvam Maitunasahishnuta Arthava Nashascha. So even this is also very important. So most of the time, Arthava Srotodushti, we have to find out how the Srotodushti has taken place. So Vandyatva is the major problem in Arthava Srotodushti. Like any other Srotodushti, this is the major part. And here nowadays, so lifestyle plays a very important role in this. Stress is the most common factor. Along with that, even we can see the lifestyle, how they sit on the chairs, and they don't move around, and standing and sitting, not sitting on the ground, or that squatting position is completely gone from the woman's life. I feel that squatting position gives her pelvic area strength. And we if you go back to our ancestors, how they used to, from their very young age, from 13, 14, 15, the girl goes to well. She brings the water, and she pulls the whatever thread, and then she carries that pot, and she cooks. She sits on the ground and cooks. I feel that is the best position or best exercise for the clear flow of Arthava. And Arthava Dhamani would have healthy with that position, which is completely vanished. And more than that, and also along with that, the way we eat. Nowadays, this craze of nutrition, I feel bad for people. They don't even understand. If I start explaining why do you want so much of nutrition, they look at me like I'm going to kill them or something. and they want to have morning some 4-5 almonds. That too they ask with seed, with the peel or without peel. Then they get ready, and they don't have time to exercise, but they have time to have that. And what kind of drink they have to have, like with hot water and some honey with lemon or methi soaked, or so many things. They go check in the internet, and they have. So these are all the, I feel these are all the one of the, just like their lifestyle, their way they take, they always think about what to take for nutrition. I asked them, are you going for some Olympics game or something? And after drinking that, again, then some smoothie, or some people have that tendency of having smoothie of vegetables, few vegetables and fruits mixed with that, and smoothie. Then after that, they have their breakfast. Then they go to office, have lunch, or at home they have lunch in the afternoon. Again, evening, some snacks and dinner, and in between maybe some munching this and that. So it is like garbage. Always they'll be eating something. So that is also one of the cause for Sroto Avarudha. So ama is formed when there is no time to digest the food. When the Agni starts digesting the food, again some more food will fall on that Agni. I just tell them, imagine your stomach, and when it starts digesting, and again something is falling on your stomach, on your maybe we kind of think like a stove, or I tell them, ಒಲೆ ಮೇಲೆ ಪಾತ್ರ ಇಟ್ಟಿದ್ದೀರಾ, ಬೇಯಕ್ಕೆ ಶುರುವಾದಾಗ ಇನ್ನೊಂದಷ್ಟು ಅದಕ್ಕೆ ಅಡಿಗೆ ಹಾಕ್ತೀರಾ, ಎಲ್ಲಿಂದ ಬೇಯುತ್ತೆ? Then they get it. So this is the situation. So girls, women are like, we are working, we are when we are and that too after like 30-40, they want to have some nutrition as their age is progressing. And every age they have, like an example I can say that I should not mention, but like Horlicks for 20, Horlicks for 30 kind of thing. So always thinking about the nutrition. So that is also one of the cause for all these problems. So Arthava Sroto Dushti can have a lot of causes. Present day, we cannot say like olden days they have mentioned so many things. Most of it are like due to excessive work, Karshyata and Atimaituna. All these were the causes for the Bandhya and these Yonigata diseases. Nowadays, Brahmana, or what we can Santarpana Janya causes are more than the Apatarpana Janya causes for these conditions. So this is like these are all the symptoms: Vandyatva, Maithuna Sishnuta, and Arthavanasha in the Arthava Sroto Dushti. So in Vandyatva, they have already mentioned like genetical, even genetic cause is also mentioned in our Sushruta Sharira. He clearly says, Yada hyasya shonite garbhashe bija bhagaha pradosham apatyate tada vandyam janayati. So garbhashe bija bhaga, if the they had very clear picture about the genetics, what we call now genetics, epigenetics. So bija bhaga, from bija itself, if there is something wrong, next the baby will definitely have the problem. Yada punarasya shonite garbhashe bija bhaga vayavaha pradosham apatyate tada Puti Prajam Janayati. So the Praja will have the problem. When there is a problem with your bija, so everything they didn't have a microscope, still they knew exactly what was happening. And then they also mentioned clearly, Yada Tvasyam Shonite Garbhashe Bija Bhaga Vevaha Stri Karanamcha. So in the there are both the Stri and Purusha Karana for infertility. In Stri Karana, so these are all the condition. Like from mother also you can get the infertility. Sharira bija bhaganam ekadeshah pradosham apadyate tadasti akriti bhuishtam varta nama janayati tam stri vyadi padam achakshate. So whichever part is in the bija bhaga or bija is affected, that part in the baby's body, it will definitely have the problem. So according to modern, so we all know, but still infertility is defined as the failure to achieve pregnancy after 12 months of regular and unprotected sexual intercourse. Approximately 84% of infertility couples have an indefinable, so that is the most commonly, we know no reason, but still they are unidentified these causes. The most common causes of infertility are ovulation dysfunction, male factors infertility, tubal disease. The remaining 15% of infertility couples have unexplained infertility, lifestyle and environmental factors such as smoking and obesity. In smoking, we can see even in women nowadays. I have seen, and I told them not to come back because I was worried that they are not ready to completely stop. and I told them I cannot help them. Can adversely affect the fertility. Ovulatory disorders accounts approximately 25% of infertility diagnosis. 70% of women with anovulation have polycystic ovarian syndrome. Infertility can be a marker to an underlying chronic diseases associated with the infertility. So most of the time they have some other problem. So because of that, infertility is the secondary condition, and that too especially after 35. Many of the women in Bangalore, we can see they want to have a child after 33, 34. They come to us to think, to ask, shall we start we want to plan our pregnancy. I tell them, you can wait for 2 or 3 more years, you get your menopause. I feel bad because this is the last thing in their mind. So they want to settle, they want to do so many other things. I'm not against studying, or I'm not against doing any great work and whatever they can continue, but they keep the pregnancy as their last option. And how can they have a healthy child? I explain to them, like, it is as the age passes, the eggs become weak, and even nowadays, egg is dying very fast. We all know human, like women, the girl child will have the oogenesis will be there in her when she is embryo. So how many eggs will release? We don't know. And once the PCOD or these conditions starts, many eggs will be destroyed. And one of Dr. I forgot her name in Pune, she has explained very nicely. How can we differentiate fertility and female? It is like one is go down, one is factory. For female, we can say it is a go down. There is a lot of things collected in the go down. If something happens, like if she gets some chronic disease, or if she smokes, or if she does some like eats unwanted things she does, so many eggs will die immediately. Like चूहा अगर घुस गया तो go down खराब हो जाएगा. She explained very nicely. I forgot her name. A very famous Sriroga specialist. So that is what is happening nowadays. Most of the time, they don't 34, 35, they say no eggs, because so much of egg destruction from the menarche we have to concentrate. Even in my last webinar, whoever have attended, I've explained, from the menarche we have to prepare the girl. We have to explain. Yesterday I had a session taken for 9th and 10th standard girls in near Mysore. So I told them very clearly. So you are the energy, you are the Shakti, because they don't know what they have and what they are losing. So I explained the human anatomy, and I told them you have to have like folic acid. Instead of folic acid, you can have more gingerly, yellow, uddu, all those things. When they menarche, these are all the things they give in those days. In family, they had a basic knowledge of Ayurveda. They used to dress them up. Even dressing is also not there. Even that plays very important role. The body gets confused. So, however, and first of all, nowadays we are very aggressive, and dressing up like a now the neutral gender is becoming more famous now. So that body gets confused whether it is I'm a male or a female. So I explain very nicely. This is like everyone is Ardhanarishwara. We have both hormones. So you want to be a woman, dress up like a woman. I tell them to have a flower, wear the flowers. If you get the smell of flowers, it keeps you happy. That happy hormones will increase. So estrogen needs all this pampering. So that is for women. What is wrong in dressing up and being a woman? I don't know nowadays where this society is going. So everything they want to change. They want to dress up, not dressing up like women, and even during periods they do so much of hard work and they eat anything. If I start explaining, they go into shock. How can you say this? It's a very bad thing. What I'm saying is a bad thing. Maybe racist. Kind of remark or something, but I'm not bothered. I'll continue with the this kind of remark. So these are all the ovulation disorders are most common: endometriosis, pelvic adhesions, tubal block, other tubal uterine abnormalities, and hyperprolactinemia. So I do some tests. I but not most of the time. Even they come with the test only, because they go to an allopathic doctor, they undergo treatment. Sometimes they have side effect and come to us. Some people, even without going to allopathy doctor, they know what test they have to undergo. They check in the internet, they do all the tests, and with the results they come to us. So sometimes I write tests, sometimes without that, and even by history sometimes we can correct their problem. And always, I'm not saying always we can help them. Many times they have left, and even we have sometimes people come with the they have tubal block or some problem, they want to undergo this IVF, but they have problem with the uterus and fundal, that it's not getting attached. So I give them one virechana, and after virechana some rasayana dravya, and even that will help them. So because always we cannot go with the same procedure, and whoever wants to help, we can help them. And this is also nowadays it's becoming common. People coming, even allopathic doctors only refer for this virechana. These words they have learned, and they tell us to next after like few years they start their own virechana line of treatment. So these are all the tests I do: follicular study and blood tests, CBC, hormone, thyroid profile, blood sugar, USG, and chikitsa. So this is the thing. So once they come with the report with the history, most of them have AMA. That is the very, not most, we all have AMA because of our lifestyle. So Nidana Parvirjana, I find out how their lifestyle and their profession and the family history is also very important. Sometimes pressure from the family or someone, like always they be telling me, wow, still you not got your child. These are also one of the reason to because of the stress. Every month they get their periods, and even if conception had happened, still because of the stress they'll just have, like, it's called swamini, it will just come out. So those history, it's very important. So whenever this infertility or this garbhasanskar couple come to me, others will curse because they'll take 1-2 hours of my time, and others have to wait. So but I have no other way, because I want to get a clear picture. Most of the time by history and by this their Agni and their this thing Prakriti, we can diagnose the problem. So lifestyle correction is very important, and sometimes they get scared. Tumba patya heltira and Ayurveda barak bhaya agate. I explain to them, not patya, it is for their problem. Just I give an example, like you have some thorn or some nail in your house, you are getting scratched by it and coming to me. I can treat your wound, but if the nail is still there, again you go back and have one more scratch. I can make money, I can treat your scratch and I can make money, but you will lose your money and your health. Then they understand this is nothing to do with the Ayurvedic medicine, this has to do with their problem. So Nidana Parivarjana, I explain, then they'll understand. At least not 100%, 50% they can follow. First of all, that nutrition or supplement, whatever they are taking, it has to stop, and their exercise has to improve. I explain to them how in our textbook Vyayama is mentioned for every day, and how was their lifestyle. These books have written, we don't know, maybe 3,000, 2,000 years ago. Still, their lifestyle was so different. They used to work in the field, they used to take the cows for grazing, they used to cook and get the water from very long distance. Still, the exercise or Vyayama was mentioned for them. So we have to do not Ardha Shakti, we have to do full Shakti Vyayama only, I tell them. So that is like must. They ask me, how many days we have to do Vyayama, all these stupid questions. I tell them, the day you eat, the day you have to do Vyayama. If you're not eating, then don't do Vyayama. Then they go to get it. So that is very important. If they don't follow the lifestyle changes, if they are not Vishadvashya, then we just get the bad name, that's all. We should clearly tell them, so this is not working for you. So maybe if you like create some fear also, they follow. Otherwise, like I had, as I was mentioning before, I had a lady, she wanted to conceive. She's 32 or something, software engineer. So I started with Damapachana, and before that she said she has cough and some breathing issues. So I started with the Dashimula Katutrayadi Kashaya and some Amapachana, Shankavati or Kamaduga Rasa. Yeah, she had some burning chest or something. So these two I have started. And she came after 15 days. She says, I think I had the clue, because most of the time Ayurveda medicines create heat in the body. So same way I I developed heat in the body. I developed mouth ulcer. I said, maybe she was looking like not like Pitta Prakriti person. She was Kapha Prakriti person. Still, how did she get the mouth ulcer? I was checking. Then, luckily, that time her mother-in-law had come with her. She said, "Did you tell her your history? Did you?" She said, "Yeah, I told everything." Then again, she asked. She was stressing. Then she said, "No." Then she said, "What is that?" And she can't stop smoking. I was like shocked. Mother-in-law is coming with the daughter-in-law, and she's reminding her daughter-in-law that you should mention that you are smoking. I was like, oh my God, where are we going? Then I said, no, then I can't treat you. You would have already lost your eggs. And she's smoking from a very long time. And this is not because of the heat of my medicine, because of your tobacco is creating problems. So you Ayurveda won't work for you. You can go somewhere. I was like pissed. I was I got irritated and I told her to go. Then she didn't. Maybe I would have had some patience and tried. But I feel if they are smoking for a long time, definitely it will definitely affect the eggs. And I have seen people with the smoking history, very famous actor also, and she has a child with the mentally retarded child she has. So I was worried and I just sent her back. So Amapachana is very important. That too, Amapachana we have to see in my I don't know, maybe people have many other method, but I see what is their prakriti and what like Samavata, Samapitta, Samakapha, I'll just check. So we can see their symptoms, and by just looking at them, we can see their prakriti. So according to that, I give Amapachana drugs. If they are Kapha Prakriti or Vata, mostly they have less appetite and they feel heaviness in the stomach and they want to eat, but they can't have the food. And morning when I get up, they feel heavy. That kind of pharma, I mostly give Hingu Achadi in the tablet form as Amapachana, or even Hingu Ashtaka will help them. And if they have like some heat symptoms, like Pittaja symptoms, I start with the Sudhshekar Rasa or Sukt in that patent medicine. Even sometimes Shankavati will help them. Like they say tastelessness or something like that. And for people with too much of heat, that Sutta Shekara will help. For Kapha Prakriti and Vata Prakriti, Hinguachadi, Chitrakadivati for even will help for Kapha Prakriti, very less Agni and to heaviness of the body, Chitrakadivati also. So like 3 or 4 Amapachana drugs I have according to their condition, and too much of heat and constipation they have, then Abhipatikara I suggest. So depending on their this ama and this even Vata Malomana has to happen with the same Amapachana and even Triphala tablets for Vata Malomana or this sometimes with they have some edema, like they sit for a long time in front of computer, they say then legs are swollen. So then I give them Gomutra Haritaki at night, 2 tablets at night. So that helps in that too if they have for Prakriti, because Gomutra sometimes it creates acidity situation. So Triphala, Avipatikara are my favorite drugs, mostly Avipatikara. So night 2 tablets I give them as Vatan Lomana. If the pitta is in their problem, and Shamanaushadhas like Ashokarishta, Lodrasa, depending on the condition. If they have bleeding disorder, any issues with the bleeding, Utrasava I increase. The Shamularishta is my favorite. This thing, I forgot to write about the Shamularishta. Even in Rasayana also, the Shamularishta is my favorite one for most because. So we know we Pittam Pangu, Kafam Pangu, Pangava Maladatava, Vayuna Netraniyante. So Shimularishta is for Vata as well as Rasayana. So even in cold related any type of conditions. So I don't give a single Arishta. I usually mix the Arishta according to their condition. Even Saraswata Arishta we can use as Rasayana as well as Shamanaushadha. It is mentioned, it is for even both male and female. This is helping a lot. It acts on the mind as well as body with gold, not the plain Saraswata Arishta. As previously I was in Kotakal for a few years, so their products that they have the Saraswata Arishta with gold, so I get that. So that also helps sometimes. And then Brahmana Shodhana Rasayana. So Shamanaushadhi, Ashoka, Dashamularishta, Saraswatarishta, Sukumara Kashaya. Sukumara, even Quata tablets I give. It helps in regularizing the periods and pain if they have. That's what we can see in infertility cases. During periods, most of them will have some problem. Maybe adhesives, or due to, like, some people have dysmenorrhea or udavarta initially. That is easily, we can treat easily with the proper exercise. Like, even I give importance to yoga. I have a yoga therapist with me. She's a PhD in infertility yoga. She helps me in these conditions, because she even advises them in the food thing. We fight with each other. She advises them rukshahara, and I tell them, no, you have to have snehayukta ahara. Then with that you have to teach them this yoga. So that we have clashed, but still she'll listen to me. In my patient, she won't give too much of restrictions. So relaxation and yoga pranayama is very important present day, because of the stress and lack of oxygen. The way they breathe, the way they eat, everything is very bad. So that everywhere it has to be corrected. Like, we can say a sheet corrects like Annamaya, Pranamaya, Manomaya. I feel our doctors should have some yoga master in these kind of situations, so that we can refer to our own doctors, Vaidya, so they have better involvement, I feel, than the outsiders. So these are all Maharasnadi Kashaya. In Falashruti it is mentioned. Maharasnadi Kashaya also helps in, it's like Srotoshodaka, and it helps us in infertility. I don't know exactly which one for what. I try with the according to their prakriti. If more pitta predominant prakriti, I reduce. I don't recommend them arishta, because I feel there will be too much of pachana in the body. So we have to control that. So for that soothing thing, I give one like Deepana Pachana I give with Sudhashekara or something, and Grita is helpful for them, like Falasarpi, these kind of things, and also Vatanalomana, Vipattikara. Depending on their condition, we have to make combination. Exactly, I don't believe in exactly following the protocol or something, because Ayurveda, we know it's a Purusham Diksha. We have to plan the treatment. By seeing them, we can decide. Leptidine is from Alarcin, it's very good as it is. And I forgot to write this Arogyavardhini. I give a lot of Arogyavardhini most of my cases, because everything starts from the liver. It is also, it's like Purana Malahara, because it acts as detox. So by Arogyavardhini, definitely it will help in correcting the cycle, and even hormonal imbalance. It will help in correcting the hormonal imbalance. Even borderline diabetes, people come with like 120, 130 fasting also, and 6.5 if they have the HbA1c, and people, the doctors will scare them like anything. They come here like they at the end of their life. Then I tell them it is not. It is because of AMA. By proper their exercise, lifestyle changes, definitely their sugar level comes to normal. Such people, I add Arogyavardhini. It is help in Amapachana. And MD4 madam is here, so it helped me a lot. So these not many this patent medicines I write, because these rasayana dravyas or whatever our classical preparations, we can differentiate which prakriti we have to give this which medicine. But in patent drugs, we don't know whom it will help. So I get confused. So I prefer classical preparations. But for with the MD4 people with the this PCOD and such Sroto Avaroda conditions, it helped me a lot. And in leptidine, it is like ulta. It people with the Rukshana, it is like Rasadhatu, it improves the milk. So that means it helps in improving the Rasadhatu. That way it helps in improving the Artava Srotas and improving the uterus, like fundus and line it's formed. So endometric layer, all these things. I don't know. I just think by seeing the Putranjiva, some ingredients, I feel maybe this will in Shatavari, all these things help in as rasayana. So that I give depending on their in Patarpanajanya conditions, leptidine will help. In some Tarpanajanya conditions, MD4 will help. That way I plan. Even Shatapushpa is one of the best. There is one doctor in Kerala, is very famous. Forgot her name. Wahida Rahman, I think. Yeah, she gives Shatapushpa in like she has very good results. She's a government doctor. And after that, I started using Shatapushpa also, and I can see some difference in Nadi. Like, because I add some churnas with the Amapachana Dravyas, like some Avipattikara churna, along with that Shatapushpa, and even Shankapasma sometimes I add by seeing their condition. So that I tell them to have once in a like night or something. Because even the taking the medicine also very important, because we cannot give, it should be practical. There are some things we cannot like add like 4 medicines now, 3 medicines in the afternoon. Like that, we cannot give 1 or 2, maximum 3 we can give. I feel like that because they don't want to take medicine. Then they say, no, many people say because we don't want to go to Ayurveda, it is like they give too many medicines. They'll be traveling. Nowadays, their lifestyle is so, like they have to, today they are here, next week, within 15 days, they have to go somewhere else. We can't tell them to resign their job and stay at home. With their lifestyle, we have to make some changes, and even what help we can do is with the less medications. If we are giving kashaya, instead of that, we can give some tablet form. And severe conditions like emergency conditions, we cannot, we have to fight, we have to tell them, so if you want to survive, you have to take this. These conditions, these are all chronic conditions, they have to take for months together. Then we can reduce the, number of medicines, or we can mix and give. So this is my opinion. So like Shodhana and Brahmana is also, sometimes what happens when we, I had this one experience. One second. One lady came, I thought she's Kapha Prakriti, and I started Shodhana. After Virechana, before that, she was getting 35 days or 40 days periods, and she had PCOD. But once the Virechana is done, she was completely, she didn't get her periods for like almost 3 months. Then she told before she had, and in before history, she didn't say, I went to an Ayurvedic doctor, I took some medicine, it didn't work. Said previously she had taken Virechana, and that time also she had same problem. And but then I stopped that, and I started with some Amapachana Dravya and Falasarpi. Then and this I think Leptidine or something. Then she got her periods. Then I realized, okay, she doesn't need Shodhana. Sometimes even though Shodhana will cause Vata Vriddhi and irregular periods or whatever, and she had like 15 days once some bleeding, then no, it is not seen. After 2 months again, little bit of some, like it's like drastic changes in her this thing. Then I realized, okay, then we have to see, even analyzing Prakriti is also very important. She has more Vata than Kapha, and she got her, when she became fat after undergoing this. She had taken for 3 years, she had taken this contraceptive pills to regulate in the period. So that was not her Prakriti. So that also we have to see. By taking that pills, she has gained some 7 to 8 kgs. So she was Vata Prakriti, and but by looking at her, she was looking like a Kapha Prakriti. Then I realized, and I changed her treatment plan. But like 1.5 years I'm treating, and she's not yet conceived. Now one cycle I have given her Brahmana Basti, and with the, she is now with the gold preparations. With that, she's I'm giving her, I don't know, Pushpadhanva Rasa I have started. I have to see what is the results. And mostly these people have, she's in a big position in a big company, so that is also one of the cause. We can't tell them to resign, but this time I told her, you have to decide, if you resign, I feel you will have a child, because women, they cannot take so much of stress. It will definitely affect their health. So I explained all these things, but I don't know. So this is the thing, Matra Basti, Anvasana, and even Pichudharana, all these things will help in nourishing the system. If they have Apatarpana Janya Vyadi, or their Prishata is there, if their body is Santarpana, or it is obese and other things, then we have to follow Shodhana line of treatment. So in Rasayana, this Falasarpi, I give Shatavari Lehya. Sukumara Rasayana is also helping, especially with the Pitta Prakriti people or more bleeding in such conditions. And Pushpadhanva Rasa Rasaushadis like Srivyadi Hararas also I give in Prabdut Papeshwar, they are preparing. And Suchika Burns, very rarely I have given. It's expensive also. So these are all the Rasayana I give. And one case I have properly recorded because that is also my mistake. I never took it seriously. I used to treat them and then they can say, okay, fine, I'm happy, that's all. I didn't take the report. And one few reports I had, but when my mobile changed, I forgot. I mean, it got deleted. So some of the record. This is like she was she was trying from her 25th year or something. She is now 30, I think 32 or something. But she had a problem with she was taking medicines for epilepsy. She had when 22 or 23 she met with an accident, and 2-3 times she developed epilepsy, so they started her under anti-epileptic drug. So with that she came to me. I told her to stop that. She was not ready to. Then I started tapering the dosage, like she was taking some 25 mg something, I don't remember, like alternate days. I started with the Tantu Pashana from Sagar company and Saraswatarishta. She is Pitta Kapha Prakriti. Then luckily she changed her doctor, and one doctor told her, because she had never had any attacks after after taking medicine also, but she had put on weight, she had mood swings, and even her husband was complaining, like she'll be if I have to call her 2-3 times, then she'll turn around, she's in her own world. That kind of situation she was in. Then I stopped all the medicines. 3-4 years they were trying, and I told them, with this drug, I cannot give the medicine, because I had a patient. The child had this. What is that? Cleft lip and palate. No, this upper palate was not there. So that is because father was taking anti-epileptic drug during conception. So that mother was like, she suffered like anything. Even now he's under my treatment. Even during pregnancy, she came to me, she was crying, and she could realize it during the scan. She found out. And after, when she delivered the baby, throughout, because she couldn't breastfeed him. So that time I used to give basic like the Shimolarishta, some things to avoid the getting cold, and like Rasaushadi, I mean not Rasaushadi, Rasayana Chikitse, and little bit of Swarna Prashana, very less quantity, to maintain his health. Now he's like 8-year-old or something. After they had done the surgery for him, like even lip and palate, everything is reconnected. But even now he goes once in a year, some Rasayana treatment he undergoes. So that I feel because of the father's condition. Even they asked in the hospital, they said maybe because of his father's anti-epileptic drug. So then we completely stopped the drug. I did the Virechana. Next month I did this Basti, because I wanted to do this Uttara Basti. I realized that she has PCOD. So we did Basti. I told her that you have to wait for 3 more months, so we can give Rasayana therapy. And I was giving MD4 for her. But like 2nd month only, she came with the results of pregnancy confirmed. Like in I think February, she found out PCOD. But in March, April, with the scan report, they've sent a single. Now she's pregnant. She's undergoing Garbhasanskar. Last time, last Pusha Nakshatra, she had undergone this Pumsavana Vidhi. Next 3rd month, I'll start her this with the this Hombale, and like we do all the whatever procedure she will follow. So this was not, I was not expecting this. So this, I have the report, and thank you. I can share some of, like, just like that, I can share some on 2 or 3 cases, because the report is only with this case I have. Okay. So one more case, she's 39, I think 38, yeah, 39. She has a daughter, third standard. It is like we can say we have like uh, we have what is as Shandi, and one is Apraja, Supraja. So this is like Sapraja. Sapraja is one child is there, but before that she had an abortion, the first child. After that she had a daughter. Then after 2 years they wanted a child, but again she had abortion. So they stopped. They didn't want to have any child. Now during COVID, they both had COVID, and their relatives were helping her. So this girl asked her mother, so what about me? When I grow up, something happens to me, no one is there for me. So both of them, when they were 32, wife is 32, husband is 42. Wife is 37, father is 42. So they came to me. I said, we can try with the whatever Garbha Samskar procedure. So both of them underwent, and all their tests were normal, but she has some like history of abortion. So they didn't want to, even their gynecologist suggested her not to go for this thing. She had some blood related, I don't remember the name, some problem with that's the reason she was, so throughout she was taking this heparin injection during her pregnancy. So she didn't want to do that. I said, we can do Deha Shuddhi will help in improving her health. So we did both. Husband wife had undergone Virechana, and then wife underwent Basti and Uttara Basti both, because 7 days Yoga Basti, 8 days Yoga Basti. In between I did Uttara Basti also. So after that, Rasayana Chikitsa for her, as it is connected with the blood, I started with the Manjishta Ghanavati and what is that? And as usual, I gave this Srivyadhi Harrasa and Avipattikara tablets. For husband, Ashwagandha, I think not much, because he has all of his values, everything were normal, and suggested yoga and good lifestyle. They were all following proper, like early. They had, that's a very important thing, is they had very good lifestyle. They used to get up in Brahma Muhurta, and they used to follow all the procedures, and that is the reason they get results very fast. People with bad lifestyle, it is very difficult to treat. So within 2 months she conceived, and she didn't take initially. Her gynecologist scared her, so she was taking this apart, and she stopped everything. She has a 4 months old baby now. The second baby is very healthy, and she's heavier when she's born than her elder sister. Normal delivery, because after 7th month I start with Basti, and before 2 months, 1.5 months only, she had her neck became strong, and she brings her sometimes whenever she feel like she gets the baby to, it's like we have a toy. We all hold her, and she's close to my clinic. So the baby is very healthy, and she looks better than the elder one, and also she is now not having any health problems. Both mother, child, they are fine. And even she didn't, I think even episiotomy also she didn't do. She has almost 3.5 kg baby. Within 3-4 hours, she delivered the baby. This is I feel nice to share. I don't know, not many, unique cases. I don't know. So, can ask questions.
Thank you so much for wonderful session, Dr. Shubhamangala ma'am. And Dr. Savitri will take next one. My thing is, my request, please stop sharing the screen, because it is, I'm saying,
Okay.
yeah. Thank you. Yeah, Dr. Savitri, please take on.
Yeah, truly, it was a wonderful explanation, and I wholeheartedly thank on behalf of all the participants for such an extraordinary session, ma'am. Now this platform is open for discussion. So anyone who has doubts can discuss, or anyone if they have any success stories can do discuss.
Hi, ma'am. Very good evening. It was a wonderful session, ma'am.
Thank
I have a small doubt.
Yeah.
You said about Tantu Pashana, and I want to know whether you continue that in pregnancy also, or for a case of history, a case of epilepsy. What do you do during pregnancy?
No, for her, I didn't give anything. because I stopped all the after Virechana and Basti. I stopped. I was concentrating only on her PCOD. So that's what I started with this MD4. But I don't have anyone. I feel you can give some even this, what is that, Hemagarbha Puttali, that is safe to give during pregnancy. I have a patient with always, she like throughout she used to get her UTI during her pregnancy. First 3 months, I think she tried something with the allopathy. Then she came to me. Almost 1 month, I gave her this Swarna Vasanta Malati. She's fine. After that, she didn't develop any problem.
Okay.
So these are all
Because we
safe
always
medicines.
get
You can give.
this epileptic cases, we feel it is a challenge to manage,
You
especially
can start
during
with Pashana. Once I was talking to the MD of Sagar Pharma as we had visited there. He said it is safe, we can give, and give me the report. I didn't give because she was fine. After that, I didn't start any medication.
Okay. Thank you, ma'am.
Just a minute. I will take a minute. Thank you so much, Pushkala ma'am, for raising this question. So I request other Vaidyas to jump in this discussion. According to me, if the patient is having epileptic history, if it needs some medication from Ayurveda side, what can be given? Whether it is, as Shubhamangala doctor said, it is Swarna Vasanta Malati, or Hemagarbha Puttali. Any other medication you can suggest, like as you said, Saraswati Arista can be given. This is my point of view. Or like any other made the drugs combination of Amruta, Veshti, some of the
Even Brahmi can be given. Yeah, gold
yes.
Brahmi.
Yeah, Brahmi with gold can be given, because here my point of view is that we need to arrest the vata. We need to, for that we need to give some oral this abhenga and some Kabalagandushanam with oil we can give. So some other external procedures also we can be given for the patients who are carrying, and along with that Rasayana as a Swarna preparation. And for Churna, we can opt those 4 are given in Charaka Samhita. We can see the condition and we can go through that. This is my point of view, and others can have their knowledge, experience, and can be shared. Because this is wonderful question, ma'am, you have asked. That is actually, it is going in my mind also.
Very true, ma'am. Nowadays we are seeing even Yosha Pasmara, where everything EEG is normal, no other condition is seen. But with stress and all, in my relative circle we have, in my friend circle I have, leave about patients side, we see them, they're very pretty strong women, not very weak, but still with stress they go into epileptic attacks.
Even Brahmi Grita you can try.
Yes, ma'am. We have given, that has given rise to severe pain in one particular part of body. Like that it is happening. So that was the reason this was going on. I have not treated epilepsy. Generally, I do refer. So when you told, I wanted to ask about that. That's why.
Epilepsy I'm treating, but not pregnancy connected.
Yes, ma'am. Thank you.
As you said, ma'am, like Gruta can be given because it arrests Vata and Pitta both.
And it is also
can we
blood-brain
give-
barrier. So best it is like it acts faster on brain.
Yes, ma'am. Yeah, that is a fatty media will act fast. Along with that, I think Abrakabasma can be given. It is indicated and it is safe in pregnancy. Lohabasma can be given. That acts on Rasadhatu and it strengthens brain system. This is my point of view.
Thank you.
And
I
other
want we want to tell one more thing, and I'm so happy by the way Shubhamangala ma'am presents, because she's so confident to stop those medicines. Many of us won't have that confidence, We think twice to stop such medicines. I'm really like, ma'am, really great. I feel
No,
so
sometimes I
happy.
taper, ma'am. I don't stop because some conditions. This girl, she never had a single attack, so I had to stop. People
Ma'am,
with
not only
history,
this,
taper.
I have
Taper.
listened to another your talks too. The way you deal with this in
Because I don't know
morning,
anything, no allopathy, so easy for me. Ignorance is bliss.
really great, ma'am.
Please, other can have their opinion on this. Yeah, Dr. Savitri, sorry.
Yeah, ma'am, one more doubt I had regarding prolactinemia. Ma'am, how to correct prolactinemia according to Ayurveda? Because it is directly, it is directly related to PCOS. I'm just bit interested to know how to correct it, ma'am.
Shodhana helps a lot, ma'am. I feel there is some balance in the hormones and these things because of the liver and stress. So Shodhana, after Shodhana, this you can go for one more check, and that's what I just look at it in the Santarpana or Apatarpana. So if I start thinking in the modern way, I get confused. So whether the Santarpana symptoms are there, Apatarpana symptoms are there. If Apatarpana, you just give Brahmana line of treatment. So that is the thing I follow. You definitely get the result because I feel our acharyas are more scientific, are more brilliant than present day. So I trust them more than present day these diagnoses.
Yes, ma'am. Thank you so much. Any other questions to be asked or to be discussed?
Can I add something? For prolactin, what I learned from my guide, we give Arkamulatvak, a very small piece of Arkamulatvak with two Nagavalli Dala. We give this on Sunday. We go collect north or east going route, and then that Mulatvak we take. Any Arka, either white or violet, that we take, and then we give only one dose. After 15 days, we go for recheck, and most of the times it will come down. And we also give some, little bit of Rukshana for hyperprolactinemia, getting result with a single dose. This is something I learned from my, guide.
Yeah, this is
Thank you so much, ma'am.
Santarpana. Yes, you are correcting
Yes,
it.
ma'am.
It's good.
Yes, ma'am. Thank you so much, ma'am.
I just want to show one case of this.
Please, ma'am. Please, ma'am.
This is a case of a patient with hyperprolactinemia. 25/8/21, it was 83. 13/9/21, it is 26.
Oh.
Only one dose of Arkamulatvaka with Nagavalli Dala is given. That's all, ma'am.
Sruto Shodhana.
Yeah, ma'am. Like small piece, of what inch, like, ma'am? Like either it is, either it should be
It's not small. That's all. Pretty small.
Ah.
This much small piece, two with two Nagavalli Dalas.
Nagavalli, sir. Nice.
Ma'am,
Really
is
very
it
nice.
Swarasa? Ma'am,
No
is it Swarasa or the leaf they have to chew totally? Ma'am, you had said me that day also I had this doubt.
Yes. Total, ma'am. Total they have to chew.
They have to chew the leaves, both the leaves, Nagavalli
Yes.
and Arkamulatvaka also. It will be hard,
Yes,
no?
Together we have to chew, ma'am.
Okay, in empty stomach.
Yes, ma'am.
Okay, thank you, ma'am.
Any specific day is mentioned, ma'am, like periods or
Arka
something?
we always take on Sunday. There is no mentioning of period days, ma'am. Ma'am used to give on every Sunday. She used to have lots of patients on Sunday for this. So that's how we learned. There was no mentioning of that. She used to give for all the cases like that only, ma'am.
Okay, ma'am.
Oh, Ahara, I think I forgot to mention. We have to tell them more of Tila and Abhyanga of pelvic area, because I have some patients who are abroad. They can't come here and they do online consultation. Some countries like Colombia, it is very difficult to send medicine. I tell them to, mostly we know how they eat red meat, and the karma is the main cause for all the and stress. So when they come to me, they'll be expert in yoga. So after yoga, they come to Ayurveda. So the Surya Namaskara I suggest and tell them to reduce the red meat. And Lashuna and Tila is available everywhere. So I tell them to cook the Lashuna in Tila and have it first, like for initial part of till first 16 days of cycle. Kafakala and Pittakala, I tell them to have. Then during however we consider as Vatakala, so tell them to some Rajaswala Charya, like sleeping on hard surface and not taking head bath and avoid junk food. These basic things for during Rajaswala this thing. So that has helped some 2 or 3 people. Some of them their periods regularized, one lady conceived. So this will also without medication, with lifestyle change and Lashuna Tila, whatever is available there. With that, sometimes not like complicated conditions we can't help. We can definitely help them, I feel.
Ma'am, one more question, ma'am.
Dose,
Can you
ma'am? Sorry to interrupt. What is the dose, ma'am? The Tila and Lashuna?
Tila, I tell them like, because most of them I have not seen, only through video call I've seen them, and I've seen with Kapha Prakriti people only I suggest these things, like 3-4 spoons of Tila, crush the garlic separately, or even Lashuna Kshira Paka for some people with the not Kapha Prakriti, Vata and Pitta, Lashuna Kshira Paka directly I tell them to have, or Tila Kashaya. For these people, like 3-4 spoons of tila and crushed this garlic. And the problem is they have that big garlic. They should have the small what we have here, desi garlic, that is not available there. I feel even that will also not, that is also not good. But we have no other way. So that I tell them to have evening or night. Actually, they have to have apanakala. So when they're free, they have to take. And abhyanga of their pelvic area with as they have their olive oil is available, and butterfly exercise with Baddha Konasana. These things I suggest them, like 1 or 2 garlic pots. For Lashuna Kshirapaka, 4 or 5 pots I tell them to add.
Thank you, ma'am. Ma'am, one more, I had interest regarding to know regarding importance of anklet in infertility and menorrhagia, ma'am. Any idea regarding this, ma'am?
Yeah, menorrhagia, we feel it is because of the Pittaja. So Vandya cause for Pittaja cause is menorrhagia. So Atyartava Pravritti. So Pittahara line of treatment with Shatavari and Kushmanda, kind of these things we have to, that is like we can say Apatarpana. We have to do Santarpana. First Amapachana with Pitta has to be corrected by Amapachana. Samapitta should be corrected. Then with the first Stambana, we can give Lajjalu, Swarasa, or any, like if you can give them different, like Chandrakala Rasa, different things. First correct the, with the Stambana, you have to correct the bleeding should be reduced. Clots and all these things will be coming. Then we can give Virechana and treat their infertility. Anything, that's the thing, no? They say by the Ayurveda, we don't they don't go for this diagnosis with the how you have your this by seeing their artava, they decide whether it is healthy or not.
Yes, ma'am. Thank you. Any other doubts, please? Oh, all the doubts are clear.
Hello, ma'am.
Yeah, ma'am. Yes, sir. Yes, sir.
Ma'am, Pushkala ma'am, Arka Mulataka is it Shweta or Rakta ma'am?
Anything we can take, ma'am.
Okay, ma'am. Thank you.
Hello, ma'am. One small doubt.
Yes.
Nowadays, most of the people are suffering from asthma, and they will be taking this oral corticosteroid for a long time. So, whether you have seen any side effects or complications because of these corticosteroids, like as you told, the epileptic medicines?
Pregnancy I haven't seen, but if they, I treat them first those conditions. I had treated a lady with severe asthma, Vamana. After Vamana, she underwent Virechana Basti. Then she conceived. She is fine, no problem. She is not having any even corticosteroids. She is not taking any of that. I make sure that they should stop all the allopathic whatever they have lifestyle. This medicines before conceiving. Very few of them had that too. They came after 7th month of pregnancy with they were taking anti-diabetic and thyroid medication. It's the last moment I couldn't help them, but others we make sure that they stop all the medicines before conception. And after
Okay.
Shodhana, definitely it will not affect their next generation.
Okay. Thank you, ma'am.
Thanks.
Thank you, ma'am. Thank you, sir. Any other doubts?
Pushkala madam, can you add on Mengrogia madam some points? Some of your experiences.
Ma'am, menorrhagia, again, we use the same, ma'am. Sometimes we go for Tikta Pachana, like either Vasa Guduchadi or Guduchadi. And sometimes we have to go for a direct Stambhaka itself, because by the time they come to us, they come with, previous lots of days of bleeding. So we may have to go for direct Stambhaka. What I have used are these general medicines only, ma'am. One of my seniors told that I have not tried. In Delhi, they give fresh Shatavari juice. Okay, immediately there will be very good action. But as we use Churna, the action is a little less. I also, not only with the medicines, I also ask them to go for, banana flower juice. At the same time, when we give these Kashaya Rasa and Tikta Rasa, Vata will increase. So I ask them to maintain Vata Agara and take these drone, this Durva Sarsa.
Yes, even I suggest Durva
Yes,
Sarsa.
ma'am. Durva Sarsa. This.
And Yashti Kshirapaka will also help them.
Yes, ma'am.
Yashti.
Lajjalu skull Sarsa also helps.
Yes.
So these are some things which I tell along with the food restrictions. So I ask them to stop masha and all, non-vegetarian food, lashuna, everything we ask them to stop till the bleeding stops at least. So this we do, ma'am. Panchavalkala Kashaya as Pana also, like how we do Gokshara Pana, 1:16 water, we just boil and, instead of normal water, I ask them to take that water. But the only problem is all these causes lot of rukshatva. So you should ask them to take little grita and all in food, make sure they are taking Vatahara, Ahara internally, or else they'll start feeling excessive rukshata in the body, ma'am.
Can we add Shadanga Paniya to this list, ma'am?
Yes, ma'am. Yes, I think we can add, ma'am. I have not
Shunti,
used.
one Shadanga Paniya without Shunti is better, I feel.
Yeah, Vinashunti.
Okay,
And I
yeah.
also take this one, ma'am. Godanti Basma, Pradhantak Rasa, Pushyana Churna combination, I generally give, ma'am.
Okay, ma'am. Thank you. Pushanaga Churna, usually I used to have this doubt. Pushanaga Churna is said in classic that it has to be taken in with honey. So how, like, ma'am? So it is.
Tandulodaka.
Yeah, along with
is
Tandulodaka, later on they will
Anupana
tell.
is honey, ma'am. Sahapana is honey. Anupana is Tandulodaka. You
Yes,
mix
ma'am.
with honey, eat it, and then take Tandulodaka.
So in this case, can we suggest honey or can you skip honey, ma'am, here?
I give, ma'am. I give in little quantity. If it is a good honey, it should not cause any, because it is also yoga vahino, ma'am.
Yes, ma'am.
Pradharantaka plus Pushanaga plus
Godanti Basma. I take 50 gram Pushyanuga, 60 tablets of Pradharantaka Rasa powdered into it, and this one, ma'am. Godanti Basma, 10 gram. I ask them to take only half teaspoon twice a day.
Even Lodra Sava with Dashmula and this combination can help. Once the bleeding stops, during bleeding, however, we can't give them arishtas. So to correct the cycle, Lodra will help. Even Churna form, Ashoka, Lodra, these things we can give.
Only Nakeshara, with that also we can stop the bleeding, right, ma'am?
Yes, ma'am. Direct reference is also there. And in Tamil Nadu, what we use is, here how we use Hombale to stop bleeding. In Tamil Nadu, Tennam Kurinji we say. So Hombale is the inflorescence, whereas Tennam Kurinji is this much small coconut will come, no? Before it forms. From the inflorescence, it's small coconuts will come. That is called as Tennam Kurinji in Tamil. That we take, we pound it and give with fresh butter. That is also very, effective in stopping the bleeding.
We give that when they cut the coconut, that tender coconat, that inside part, that it is astringent, kashaya rasa. Even that will help in like home remedies.
Oh, okay.
Even this, I told no, this hibiscus, that leaf and that flower, they prepare chutney, or we call tambuli in our native
Yes,
place.
yes.
So that will also help in correcting the bleeding. Even this Kushmanda is also very good. Kushmanda juice and even lehya form.
Ma'am,
Some
hibiscus
cases I have
nowadays.
seen that. Sorry to disturb. I'm sorry.
Sorry,
Some
sorry.
cases I have seen that generally we give kashaya rasa pradhana, but banana flower juice I have observed in 2-3 cases it is increasing bleeding also. So maybe excessive vata prakriti we should be careful of giving. Any such experiences, ma'am? Generally we give to reduce, but then suddenly it increases.
Not with banana leaf flower. Some things happen like the ulta effect suddenly
Yes,
develop.
yes, ma'am, I am having the doubt like a banana is usually we said na chara. So how it helps? Usually when you said no, I was having that doubt. Tikta kashaya, ma'am. So stambaka, ma'am. Ma'am, I have been using recently also we did first one Uttarvasti we did no, ma'am, in Geeta ma'am's place, fibroid case. She is also a case of heavy menstrual bleeding. So after Uttarvasti, generally the bleeding increases for the next cycle. She had lots of bleeding and apart from the medicines also it was not reduced. So we suggested only this. Within next day it had controlled, ma'am.
Oh.
Many other country patients where sending medicine is difficult. All these home remedies only we depend on mainly. Ma'am, how much this banana leaves kashaya should be done? Banana flower. I asked them to make it into half. Half in the morning they have to make fresh juice. Evening half with fresh juice. Little honey if needed. Flower, banana flower it is. Flower, yes, ma'am.
We make chutney during the second month delivery in our native place. Second month, we start with the banana flower. The first month, the bleeding should be cleared. Second month, to stop, arrest the excessive bleeding and to strengthen the system. This third month, rasayana chikitsa with dry fruit, laddu, and these are all home remedies in native.
Yes, yes, ma'am. Ma'am, can you explain about Vasti you told in pregnancy, ma'am?
Last 7th, after 34 or 35 months, 34 weeks, I start Anuvasana Vasti or Matra Vasti, depending on their health. Once a week, I call them and give them Dhanmantra Savinavarta or some this thing. No Abhyanga, nothing. Just pass the when they go to toilet, it will clear. That will help them in like there won't be any. It is like a lubricating during. Depending 50-60 ml, because my therapist, she's from Kerala, she's well versed in that. So 60 to 70 ml we give them, and they go in the evening or sometime they pass the this thing.
Ma'am, what about Kashaya Vasti? Have you given?
No, not tried. One of my friend gives the Shimula Kashaya Vasti in last last 2-3 weeks. I didn't try any.
I know few doctors who are giving. I also not have tried, so I thought if any of us have that experience, we can.
My friend, she says it's the backache, everything will be cleared. But with Thaila only, I'm getting very good results. So they enjoy. Initially they'll be hesitating. After a week, they ask when should I come next time. So with so I didn't try anything else.
Okay, thank you, ma'am.
Hello. Sorry. Ma'am, in continuation with that query only. So Matra Basti weekly once you said you will be giving. For how many sessions, ma'am? How many weeks?
Still they deliver 33, 34 weeks later. And I feel even because of the Apanavayu anuloma, the delivery dates will also be late. They'll wait till the date. Even some people, even after date, I tell them not to go. If whatever they suggest, just stay, relax, and you can go for, if you have any fear, you can go for scan, not for, because 1 week early they want to induce. So I tell them to relax and go after a day of delivery. So they have full term, very healthy body and mind, baby.
Thank you, ma'am.
Ma'am, what I used to do in Pune is in 7th month I used to give one time Tilatai Basti 16 month. In the 8th month 15 days once. In the 9th month weekly once. I used to give.
Okay, yeah. I don't give in 7th. 8th month onwards, I start. 8th, 15 days. 9th, once a week.
Okay.
Thank you, ma'am.
Just adding to the thing, last week we had Agnivesha, no, ma'am. Jogat sir spoke. So he had this Kashaya Basti formulation after in the 9th month for pregnant women. So I'll share the slide later.
Yeah, because
Please.
maybe I'm a lazy person. Whatever I feel comfortable and I get results, I don't take
No,
risk. I
no,
just continue with that.
I didn't mean that way,
No,
but
I know.
maybe.
We have to add, we have to go further. I would have tried, even my friend suggested me to give the Shugula Kashaya Vasti. I said, no, I'm happy with
No,
this.
ma'am. Even
Ma'am, if
even you
Shubhamangala
were.
ma'am says, ma'am, if you say you are lazy, what we
No,
have to tell about
no, people
ourselves, I
suggest
don't
so many things. They tell me you can add this, you can. I said no, I'm happy with this, and because I'm scared. Sometimes may give some advice because now it is giving results, no. So I'm continuing, but we have to share what you have, Dr. Nivedita. It's good. You can
Yes,
share.
ma'am. We were there, no, ma'am.
Yeah.
Last
I know.
session, we were there together, and Pushkala ma'am was not there in that session. So I remember she was
Very
asking
good.
about
Yeah.
Yuzuha
The way
Basti.
he explained very nicely, and even he prepared that Basti thing. It was very good.
So that was Kashaya Basti. So he said after 9th month, I mean after 8th month completion, and he has got good results. That's why I was mentioning. That's it. No other thing.
No. I'm just making joking. That's all. I'm very happy that you've mentioned that.
Okay.
Can you share, Dr. Nivedita, please?
Have this people are nowadays the massage during pregnancy and all. I'm scared. Why? Because it is not mentioned in our text.
It's
They are
actually
making money with
contraindicated.
they
Just
do
a
this.
minute. I'm just checking the slide. I'll be back in 2 minutes.
Yeah. So we have to be careful. This pregnancy massage and all. I would never suggest. I tell them to do it yourself, or if you have severe backache, tell your husband or someone to just do the back massage very mildly. Not like body massage during pregnancy is also. It's becoming very common nowadays. So we have to educate the society about it.
Ma'am,
I think
I have.
adding to this, yeah, please go ahead, Amulya.
Okay, thank you, ma'am. Ma'am, regarding this Hombale Rasayana, no? So many people have many, I mean, there are so many variants. Can I know what method you use, ma'am, Shubhamangala madam, so that we can upgrade ourselves?
No, not
Also,
upgrade. Each have their own. No, it is good. What you are doing is good. I have my own method because usually these traditionally they give red this chemical sakre, badami, and kesari or something. I never use kesari because it is ushnavirya. So instead, I third month as it is hridaya is this thing. No, so I add a little bit of. Pravala Piste is always I add. Maybe Arjuna Churna I add to that. And if they have no vomiting and all, a little bit of Yashti Churna so I add. In 5th month when I call them for 20th week when I call them, I add it is Buddhi Panchami Buddhi. So I add some Brahmi churna to the preparation because we cannot give them more tikta rasa also. So, and as we know, we don't, we tell them not to have amla, katu, ushna, all these things during the Sambale. So, and 7th month when they come, I add Shatavari, like overall development to the preparation, Madhyashti, Shatavari, something like that, depending on their prakriti also. Too much of pitta, I try to add little more of Shatavari and this thing. So mainly for this Hombale and these things, Badami and Kalsakre, they add.
Quantity of Hombale, ma'am?
Same thing, that quantity maybe
one
like 1 spoon of Hombale, and with the churna and everything, it becomes 2 spoons or something. And mix it with the this cow's milk and give. In my clinic only I tell them to have luckily, I mean, for their bad luck, they are coming. I'm coming 10:30, so they have to wait till I give them. That is also a bad habit. Next day, I tell them to have it at home. I give it to them.
Ma'am, how many days you give? 2 days or 3 days?
3 days. 3 days.
3 days. Okay. And the patya is
Yeah.
completely restricted. Amla,
I
lavana.
tell them they can have bland food. Actually, they are supposed to have milk and rice, but nowadays they don't want to have. So I tell them to have bland food, like bland khichdi or sweet. They can have payasa and all these things. Rice with that's what. Try to tell them to avoid all these things if you want a healthy baby. I just create them some fear, then they follow.
Thank you, ma'am.
Thank you.
Yeah, for Hambala preparation, Kesar, why we are adding, it acts as a Pachana Dravya along with Varnakara. It is very good Pachana. That's why, because the combination whole itself is Madhura Pradhana Rasa. And yeah, that is my point of view. And slowly I will increase, like in third or fourth month, I will put 1 or 2 this thing of Kesar, and later on I will add more in 5th or 7th month. That is the thing, ma'am. And one more question, one more thing adding to note for Basti, that whatever Kashaya Basti they are practicing, I think if the Ama condition is there, then we can opt for Kashaya Basti. If there is no Ama, Nirama condition, then as you said, we can go for Taila Basti or Taila Basti. Because I have tried in 2 patients, it was looking like it was they are not having a normal labor. After continuously I have given for 5 days on 9th month. The normal delivery happened. That what very near to labor. That time I have given actually.
What you have given?
And one more thing, I gave first 3 days I gave Dhanvantram Taila, ma'am. After that I gave Kshirabala Taila, ma'am.
Not Kashaya.
And
Okay.
no, I have not tried. Now only I thought, like, if Kashaya they are giving. So if Ama condition is there, then we can go with very little quantity of Kashaya Basti, not to that classical. We can go with the maximum of 100 ml or 80 ml of Kashaya to make that place like Nirama Sthiti. Then we can go with Taila Basti. This was a thought came when everyone is sharing. Yeah, ma'am. And in Rajasthan and Gujarat, one of the patient 3 days back, she shared, like in 8th and 9th month, they will start taking Tila Taila. Or in almost all food, they are preparing with Tila Taila only. Even sweets also prepared by Tila Taila only. That's what she shared. That too with good Taila. They are getting, no, ma'am, Gana Taila. That what. So from that. This thing, because I am not using that I am not telling any patient, but now today itself I have started to telling those who are in 8th or 9th month now. So they are actually classically they are doing that. We can also tell patients for preparing Tilataila, and of course it depends of the Prakurti also.
There they were using in the food. I was giving in the Basti.
Okay.
Only till
Yes, you have to in the 7th month once, yeah. Yes. But if they are taking in food, and they told, like I have told them to massage also in the back area, because that yeah, Nivedita, please go ahead. Yeah, Nivedita, you can unmute yourself. Any more thing to be shared by any other Vaidyas? Yeah, Dr. Savitri, please take on.
Hello. Sorry. Hello.
Yes, ma'am.
Yes, shall I tell?
Yes,
I hadn't unmuted, so I was just telling. That's what I was mentioning about the Niruha Basti, what Jogat sir had told. So he has named it as Sukaprasava Basti, which has to be given after the completion of 8th month. So that ingredients has mentioned. One is Badara, Bala, Atibala, Shatapushpa, Kshira, Gruta, and Taila, he has put Madhura in bracket. And then Dadimastu, Madanafala, Saindava, and Madhu.
Maybe I was not hearing that, ma'am. I was anchoring in the morning, no, so I didn't hear.
Yes. You were busy, ma'am. I was watching. So that slides, everything, he was very fast also. So the quantity and all, nothing is mentioned.
Dr.
Only
Nivedita,
the
sorry to interrupt. Dr. Archana madam has put in the group that screenshot. You can share if you want, or else I can share. Wait 1 second. Yeah, is my screen visible?
Yeah.
This is the
Yes, ma'am.
Dr. Archana ma'am has just.
We have Sukha Prasavagruta, no? That also we can, I think, maybe it has mainly Bala Mula and different. I give them last month of the this thing, 9th month, 8th month only. I start Sukha Prasavagruta from Kotakal or any Sitaram Ayurveda. So that will also help them, I think.
I do this Kashaya Basti, ma'am. Usually it's told in 8th month, but not to induce or trigger too much. It will be given in the mid of 9th month, but it's not the quantity of the original Kashaya Basti. It will be half of the quantity, along with the Yoni Pichu, Yoni Abhyanga, and Matra Basti. This can be given just maximum 3 times. Not too many times.
Okay, ma'am. Thank you, Dr. Babita.
One of my student has taken this Vasti from a doctor in Chennai. That madam is also pretty famous. I'm not remembering the doctor's name. So she gives 8th month, she gives Kashaya Vasti, and 9th month, Taila Vasti. So I actually wanted to talk to that madam. I never had the chance to go and visit her. But what my patient had told is immediately, in their house, people were scared because that abdomen became a little smaller. So much of gas went away, it seems. So they felt, what is this? Growth has come down. That was the feeling they had. But she was feeling very good relief, it seems. If I have a chance, I'll talk to that doctor also and I'll share in the group. Thank you.
Maybe we can give it to the patient with the constipation history or gas. Always
Yes,
they have this Udavarta condition. We can give the Shumula or Sukha Prasava Kashaya Basti. We should try. If I try, I'll definitely share it.
Definitely, please. Thank you,
As per my knowledge, it's mentioned mainly for Purana Mala Shodhana and Vata only. Also, it helps in patients who have posted for C-sections and also who have small pelvis and all. Usually, Matra Basti and Pichu will only help, but this adds on more. Also, what I have heard is even the delivery pains or cramps, it will be reduced. But most of the people hesitate to take this. After educating them, whoever comes forward with comfort, then only it's possible. Many people, they hesitate.
And Dr. Babita, have you given this thing? For how many patients you have given?
Ma'am, in my whole practice, I have given hardly for 5 people, that's all.
Oh, okay.
Any doubt?
But as mentioned, the quantity will be half the quantity.
Have you tried with 250 ml?
No, ma'am, it will be usually 150, 200 ml maximum.
Okay.
Because not to induce any pressure on the baby and uterus as well, it's usually half the quantity.
Thank you.
Shall we wind up, ma'am? It's almost 10:40.
Ma'am, one more question.
Yeah, please, ma'am.
Ma'am, here is my case, is the infertility case. She is 33 years old, working woman. She came with 2 cycle of IVF. So yeah, she's having a Pitta Vata Prakriti. So I did Virechana Karma. Then I asked to follicular study. Continuously, I took a 3-month follicular study. Every month she's getting simple cyst or hemorrhagic cyst. on day 17. And endometrium thickness will be 11.3 or 12 mm, 12.6 mm will be there. Every month she is getting hemorrhagic cyst or simple cyst, but in both ovaries, ma'am.
She needs Brahmana line of treatment because after Virechana, first of all, Vata Pitta Prakriti. Again, she is attained, again, Krishata has taken place. Brahmana can help her in attaining the normal this thing.
I didn't given, ma'am, I didn't give any induction with any Ayurvedic medicine or allopathy. Just I asked to just normal follicular study without any medication. Means I given Shankavati, M2 Chandra Prabhavati, like, but didn't induction of ovulation. She's getting every month like this only, and her husband having a DNA problem, ma'am, in sperm.
So both
Just
of them have to undergo the treatment, no? So even Pushkala ma'am can, because I don't follow much of the thing. I feel it is Pitta Vriddhi. Hemorrhagic cyst means Pitta Vriddhi kind of treatment, the problem. So Grita can help her. Pushkala ma'am must be having better this thing for her.
And her husband, the very poor sperm DNA integrity is there, and karyotyping is both normal, both couples.
Ashoka Grita and this Palasarpi, all these things will help in correcting her ovulation. That's eggs.
Okay. Ma'am, Pushkala ma'am.
Generally, what we do,
Can you
ma'am,
help him?
when we see that they go into,
I think as Shubhamangala.
Sorry, ma'am. Ma'am, you were telling something, ma'am. Okay, so generally when we all go into such sister, that cycle we generally ask them to go for a, because after that generally we see it around 22 days, 20, around 22 plus they get that endometriotic cyst when it is not ovulating and becoming into a cyst. So that cycle we ask them to go for Pittahara Chikitsa only, like either Grita or Vasa Guruchadi Kashaya, like that I ask them. At the same time, for next cycle, in the very beginning itself, that is even from the first day, we start that Ushna Dikshna Chikitsa and stop it even before 12th day, so that does not happen. Only stimulation with Naga Kesra we can take or Nasya we can take. So generally, I follow this. Next cycle, they tend to ovulate.
Okay.
The Pushpa, no, Yashtimadu Nasya helps a lot in irregular and Ushna kind of like bleeding, increased bleeding and such condition.
Okay. And she's having also 24 and 25th day of cycle since menarche.
Ma'am, Nasya, whether after the bleeding stops or even in the active phase of bleeding, because it will be for days, no? So how can we plan?
I never tried during bleeding. During bleeding, first thing is we have to, if it has increased, Stabbaka line of treatment only I tried. Then after it stopped only, I tried with Nasya for 1 week, maybe during this ovulation, around the ovulation time. So Pitta Kala, I have suggested this Nasya.
Okay, ma'am. Thank you.
Ma'am, what the Pushkala madam and Shubhamangala madam mentioned, this banana flower, is it whole flower with the brown portion or only the inner white flower?
We take the whole one, ma'am, because even that rind, which is, that brown color, is also more of Kashaya Pradhana.
That brown only. And if you take that white part, that remove that strong, that kaddi kind of thing, no? We remove and add that. I think
Hello, madam. Hello. For hemorrhagic cyst and simple cyst in continuation, we can give Chandakala Rasa with Moktik from 8th day to 18th day. So it may avoid hemorrhage and cyst also. Or else if Pitta is very high, we can go with Suvarna Shikara also. Usually in our practice, we will use if Kapha Prakriti dominant, Mahalakshmi Vilasa Rasa with gold. If it is Pitta problem, we will use Suvarna Shikara.
Okay, sir.
Namaste.
Any
That's all, madam.
experience with hypothyroidism cases?
Hypothyroidism will use Tapyadiloha. We need to maintain, madam. We need to maintain TSH level below 2.5. Otherwise, induction cannot be happen properly. Regular thyroid treatment we need to start.
With my patients, I have stopped, and my yoga teacher, I told she's very good. She helps with the report, normal report only. We went for the 3rd or 4th month. I had shared this in Sitaram Ayurveda. So we had stopped her thyroid medication with the lifestyle changes, and I didn't initially I thought of giving her Kanchana Ragrita, but without that we could help. So only Sutashekara I added for few days. That's all.
No, if they come before pregnancy, we can definitely.
During pregnancy only she came, but I couldn't help much. But with yoga, it helped her.
Especially hyperglycemia and hypothyroidism during pregnancy.
Yeah, hyperglycemia, we can give many medicines. I have tried with even this thing like Vasanta Kusumakar also we can try. But for my patients, Kashai, this Asanadi and Nishamalaki, one of my friends suggested, even Vasanta Kusumakar she had given, I didn't give. But with this, we can control. And especially this yoga is very important to control instead of giving too many medicines. With if the yoga person is very good, they can completely control the blood sugar level.
Here, this bit is closed. We ignore. While drawing this neckline, we ignore.
Hello, madam.
Yes, sir.
What is the opinion about the Garbhapala Rasa? During
I have given it, sir. I have given with the previous history of abortions. For first 3 months, I had given Garbhapala Rasa. Even in spotting cases, even recently, I had a lady with a history of cancer. She didn't go for this chemo after this. Breast cancer. She after the surgery she came to me. I did all Shodhana initially with Shamana Rasayana, then Shodhana again. After Shodhana, she want because she belonged to Muslim community. They wanted to have second child, so that is a very important thing. So that's the reason she didn't go for chemo. So now she is conceived, but she's like once in a week or twice a week she's developed spotting. I gave her Palamula Kashaya and this Garbhapala Rasa. She's continued from last 15 days and she's not seen any spotting there.
Okay. And most of my OPD patients, when they came with a pregnancy and all, randomly I used to give the Garbhapala Rasa for 3 to 4 months. With that, I give most preference for the food regimen, means Ahara Vihara. That gives a lot of problems to be reduced, like vomiting sensation or body pain or constipation or something else. And what you told about the Nuvasana, this thing, a basti, Taila basti, no?
Yes.
That 100% reduces the burn. As Shushruta told, within 45 minutes, that oil, when it applied to the body, it goes inside the bone marrow itself. It doesn't come through the motion, no? After when they pass the stool and all. If at all it comes, maybe the extra oil it will comes out. And about the pains and all, it's 100% gives the result, madam.
Yes, they have like 3-4 hours. Many of them said 4-5 maximum. That to primary, 3-4 hours they had pain.
And Garbhapala Rasa gives a lot of result. And what is your advice to them for the second child? Are their child going to marry? How to avoid all these problems? What you are going to advise to them? What we used to advise to the patients when they came with a child, for the next.
That's what we tell them to undergo one shodhana before. If they undergo Garbha Samskar, we no need of telling. But if they have no idea about that, for second, I tell them to plan with the like customized baby, what we tell in Gujarat. So they enjoy it. They want to have second baby with all the plans. And I tell them for other things you plan, only for pregnancy you don't want to, because that's the last thing in your plan. So they understand. And
Okay. Thank you, madam.
thank you, sir.
What's the Anupana for Garbhapala Rasa, Shubhamangala? Right?
So I suggest these things very rarely, ma'am. I don't suggest any medicines throughout 9 months with the A2 ghee, A2 milk. Most of them, only with that it helps. And I make sure that they have to take A2 ghee and A2 milk. Only with the history of some like abortion or like as I mentioned, she had cancer. Such cases, I suggest these things. Even I had mentioned in this last seminar, one patient with this scan showed abnormal like no nasal bone. In that case, I started with the hemagarbha puttali, or any a problem is there, I start with the rasaushadhi. Otherwise, no aushadhi at all. Sometimes I give granules of, we have this Garbhopanishad Foundation granules. If they feel uncomfortable without taking any medicine, I take care of their Agni Ama. That is the thing. Even maybe some Pravala Pishti or basic thing. Or I tell them to have Jirik Kashaya with the Dhanvantar Gulika regularly and Madifala Rasara. That's the basic thing I give. Other than that, if they need something like hemoglobin, if they have less, then I add some Punarnava Mandura or something. Or I tell them to have this dry Vanadrakshi, soak it at night and have these things only I try to manage. But a lot of A2 ghee, A2 milk. I feel in olden days, that was the thing they were taking care of the health. Only with the problems, I give medicine. I tell them, they get confused why you are not giving any medicine. I said, it's a natural process. Follow the lifestyle changes and have A2. I make sure that they buy A2 ghee and A2 milk. That's all for normal people. And I add with this Humbale and Pumsavana and Basti. And otherwise, no medications at all.
Hope all the doubts are clear, ma'am. It's almost 2 hours.
Hello, madam. In continuation to Garbhapala Rasa, hello, madam.
Yes, sir.
I want to add my point.
Yes.
So, Garbhapala Rasa, many physicians will tell it contains Naga and Vanga. Instead of giving good results, sometimes it may affect the growth of the baby. So while selecting Garbhapala Rasa, we should be very careful about the company and all, about the preparation and all. Some Vaidyas will advise, instead of going with Garbhapala Rasa, you can go with Garbha Chintamani with gold. So that is the better advice we can go with. So it is better costly, but it's good drug. Good drug of choice.
So one thing I want to add for Garbhapala Rasa, like in classics, in Gujarat, I am bringing some medicines, Masika Garbarudhi medicines. I mean, bringing from them. So they have told, in classics themselves, they have told that along with Garbhapala Rasa, to avoid this Naga and Vanga side effect, Drakshadi Kashaya at night, that to be OD dosage, that has to be taken. That is the indication that what they have told. I am following that. And for like up to sometimes, if Garbhavruddhi is not correct, then I will given up to 8 months also, sir. So Drakshadi Kashaya has to be, this dry grapes Kashaya has to be prepared, and after the taking Garbhapala Rasa, one OD at bedtime, that Drakshi Kashaya has to be treated. that will cut that side effects.
Rakshi
Yeah,
Kashaya, not Rakshadi, right?
Actually, yeah, I am following because I am bringing that from Gujarat, no ma'am, from Garbha Samskara.
That
Yogesh.
granules I give for some patient who wants the medication. They feel like, oh, without that, because I don't give them folic acid, iron, calcium. So just to keep them happy, I give for some people, not this thing. And Krita also, if the growth is not very good, we can start with the this Falasarpi also first 3 months. It can help them if they have any history, Falasarpi, and if the lady is very weak, Falasarpi will help her to attain the this thing, to attachment of the this embryo. First 3 months Falasarpi. Later, after 7 months, Sukumara Grita also help in constipation and this thing. Because this is not the infertility was mentioned, no? So I didn't bring up all these things. So,
Even Garbhapala contains Loha also, madam. Aparajita Bhavana is there in that. So we can use, but company we need to sure that they will do proper
it's very important
Shodhana
for all
of
the
Naga and yes. For hyperproteinemia, prolactemia, you have discussed, madam, during in the last session. We can add one more drug, madam. Even Sanjeevanivati also I tried. We have got very good result in prolactemia. And even Gomoza Ritaki also got very good result. Even just Rasapachaka Dravyas we can use, we will get very good results until there should be no cyst in breast. Then we will get very good result. Only it's just negative feedback mechanism from FSH and LH. Prolactin will increases. It will reduces if FSH LH becomes normal. Just by giving these medicines, it will work, madam. I have tried in many patients.
thank you, sir.
Sir, can you repeat what medicine? There was no network.
So Rasapachaka Dravyas can be used. Rasapachaka Vati is available, and Gomutra Ritaki and Sanjeevanivati. Sanjeevanivati contains Bhavana with Gomutra. So it will work in prolactemia, hyperprolactemia.
Sanava is there, no? Sanjeevanivati.
Yes.
Sir, for
So
how
it
many
is
days?
just because FSHLH decreases, prolactin will increases, or else prolactin increases, FSHLH decreases. So it is just many a times it's because of negative feedback mechanism from FSH and LH. So if you make FSH LH proper, then prolactin will reduces. So only one thing we need to monitor is there should be no cyst in the breast. Many a time some abnormal cyst in the breast will secrete more prolactin.
So Rasapachakavati,
That's very
Sanjeevani Haritaki and
Gomutra Ritaki and Sanjeevanivati.
Okay.
Sir, how many days?
So 15 days, 1 month.
Okay, sir. Thank you.
And even in meteorology conditions, we will go for Vamana also because we consider it as a Adogat Rakta Pitta. In many conditions, we got very good result with chronic meteorology with Vamana. That can be done, madam. And Vasa Patra Swarasa, Durva Patra Swarasa yields very good result, very faster if it is available. Durva Swarasa excellent, madam. Even Ashoka, single Ashoka is excellent. Ashoka also we used. Okay, madam, that's sir. We will wind up.
Sir,
Thank you,
dosage,
sir.
sir?
Thank you very much, sir.
Sanjeevani, Gomutra Haritaki, dosage, sir.
BD, 1 BD, madam.
Okay, sir.
And
Yes, ma'am.
Falagruta, one more drug we can add in meteorology condition is Falagruta. Only simple Falagruta, 1 teaspoon TAD also we got very good result, madam, in many cases. Falagruta with Shatavarigruta, meteorology. Pitta Pradana.
Thank you, sir.
After.
Yes, thank you. Thank you, sir. So, hope let's wind up the session, sir. Madam.
Okay.
Yes, ma'am. Thank you very much for
Thank you, ma'am.
Share.
I
Yes,
hope
ma'am.
it is useful.
Ma'am, last few words, ma'am, regarding because with all these things, we can grow our confidence in treating cases, and process of learning and growing together will be continued. And thank you all for being part of this session, wonderful session. Madam, ಮುಂದಿನ ಸಾರ್ತಿ ನೀವೇ ಕಂಟಿನ್ಯೂ ಮಾಡ್ತೀರಾ ಮೇಡಮ್? ಶುಭಮಂಗಳ ಮ್ಯಾಮ್ ಸೆಷನ್.
ಇಲ್ಲ ಮೇಡಮ್, ಯಾರಾದ್ರೂ ಮಾಡಿ ನಾನು ಟ್ರೈ ಟು ಜಾಯಿನ್. ತುಂಬಾ ವಿಷಯಗಳಿದೆ, ದಿನ ಏನಾದ್ರೂ ಒಂದು ವೆಬಿನಾರ್ ಇರುತ್ತೆ. ಐ ಟ್ರೈ ಟು ಜಾಯಿನ್, and if I have any doubt, idea, I can share.
Yes, ma'am. Ma'am, ಪುಷ್ಕಲ ಮ್ಯಾಮ್, ಲಾಸ್ಟ್ ಟೈಮ್ ನೀವು PCOS ಡಿಸ್ಕಷನ್ ಮಾಡಿದ್ರಿ. ಸೊ ಹೋಪ್ ನೆಕ್ಸ್ಟ್ ಸೆಷನ್ ಅದ್ರ ಮೇಲೆ ಡಿಸ್ಕಷನ್ ಮಾಡಿ, ಒಂದೊಂದು ಟಾಪಿಕ್ ಅಲ್ಲ ಡಿಸ್ಕಷನ್ ಮಾಡ್ತಾ ಅದ್ರದ್ದು ಡಿಟೇಲ್ಡ್ ಡಿಸ್ಕಷನ್ ಮಾಡಬಹುದು ಅನ್ಕೊಂತೀನಿ ಮ್ಯಾಮ್. ನಿಮ್ಮ ಏನಾದ್ರು ಅನಿಸಿಕೆ ಏನಾದ್ರು ಹೇಳಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀರಾ ಮೇಡಮ್? ಮುಂದಿನ ಸೆಷನ್ ಇಂದ ನೀವು ತಗೋತೀರಾ ಹೇಗೆ ಮೇಡಮ್?
Ma'am, one more session we were talking actually last time. Shakuntala ma'am ಹೇಳಿದ್ರು, ಇದು ಕೇಸಸ್ ಡಿಸ್ಕಷನ್ ಇನ್ನೊಂದು ಸೆಷನ್ ಮಾಡೋಣ ಮ್ಯಾಮ್?
ಎಸ್ ಮ್ಯಾಮ್, ಒಂದೊಂದು ಟಾಪಿಕ್ ತಗೊಂಡ್ಬಿಟ್ಟು ಅದನ್ನೇ ಡಿಟೇಲ್ಡ್ ಡಿಸ್ಕಷನ್ ಆ ಥರ ಮಾಡೋದಾ ಮೇಡಮ್, ಹೇಗೆ?
ಓಕೆ ಮ್ಯಾಮ್, ಹಂಗಿದ್ರು ಐ ಥಾಟ್ ಕೇಸಸ್ ಬಿಫೋರ್ ವಾಟ್ ಮೆಡಿಸಿನ್ಸ್ ವಿ ಹ್ಯಾವ್ ಯೂಸ್ಡ್ ಆ ಥರ ಕೇಸ್ ಡಿಸ್ಕಷನ್ಸ್ ಮಾಡೋದು ಅಂತ.
ಹಾಂ ಮೇಡಮ್.
ಓಕೆ ಮ್ಯಾಮ್.
ಅದು ಸೊ ನೆಕ್ಸ್ಟ್ ಸೆಷನ್ ಕೂಡ ಕೇಸಸ್ ಡಿಸ್ಕಷನ್ ಆಗಿರುತ್ತೆ ಅಲ್ವಾ ಮೇಡಮ್ ಹಾಗಿದ್ರೆ?
ಎಸ್ ಮ್ಯಾಮ್.
Okay. So the next session will be again the discussion on cases regarding infertility, and later on any success stories can be shared by everyone. Everyone has to participate, and please kindly share your experiences, because ನಾವು ಒಬ್ಬರನ್ನೇ ಟಾರ್ಗೆಟ್ ಅಲ್ಲ, ಎಲ್ಲರೂ ಶೇರ್ ಮಾಡೋಣ. ಎಲ್ಲರೂ ಸಣ್ಣ ಪುಟ್ಟದಾದ್ರೂ ಪರವಾಗಿಲ್ಲ, ಎಲ್ಲರೂ ಶೇರ್ ಮಾಡೋಣ. ಲೆಟಸ್ ಈಗ ನೋಡಿ, ಎಷ್ಟೋ ಹೋಮ್ ರೆಮಿಡೀಸ್ ಮೇಡಮ್ ಹೇಳಿದ್ರು, ಸರ್ ಹೇಳಿದ್ರು. ಸೊ ಇಂಥ ಸಣ್ಣ ಪುಟ್ಟ ಕ್ಲೂಸ್ ಸಿಗ್ತವೆ. ಸೊ ನಮ್ಮ ಎಲ್ಲರೂ ಶೇರ್ ಮಾಡ್ಕೊಂಡು ಎಲ್ಲರೂ ಗ್ರೋ ಆಗೋಣ ಅಂತ ಹೇಳ್ತಾ, ಮೇಡಮ್ ಹಾಲ್ಮಾ ಮೇಡಮ್ ಹ್ಯಾಂಡ್ ರೈಸ್ ಮಾಡಿದ್ದೀರಿ, ಏನಾದ್ರು ಹೇಳ್ತೀರಾ?
ನಮಸ್ತೆ ಮೇಡಮ್. ಏನಂದ್ರೆ ಈಗ ಒಂದು ಯಾರ್ಯಾರ ಹತ್ರ ಇವಾಗ ಸ್ತ್ರೀ ವ್ಯಾಧಿ ಬರುತ್ತೆ ಅವರೆಲ್ಲ ನಾವೊಂದು ಈಗೇನ್ ಕ್ವಶನರೀಸ್ ಮಾಡ್ಕೊಂಡಿದ್ವಲ್ಲ ಮೇಡಮ್ ಪ್ರೀವಿಯಸ್, ಆತರ ಒಂದು ಕ್ವಶನ್ ಫ್ರೇಮ್ ಮಾಡ್ಕೊಂಡು ಆ ಕೇಸ್ನ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಅಂತ ನಮ್ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಇದಾರಲ್ಲ, ಅವರು ಆ ಕೇಸ್ನ ನಾವು ಯಾವ ದೋಷ, ಯಾವ ಧಾತು, ಆ ತರದಲ್ಲಿ ನಾವು ಯಾವ ಸಿಂಪ್ಟಮ್ ಇದ್ದಾಗ ಯಾವ್ದನ್ನ ಕನ್ಸಿಡರ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಡಿಸ್ಕಷನ್ ಮಾಡಿದ್ರೆ ನಾವು ಸ್ಟಾರ್ಟಿಂಗ್ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋರ್ಗೆ ತುಂಬಾ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಅಂತ ನಮ್ದೊಂದು ರಿಕ್ವಿಸಿಷನ್. ಪುಷ್ಕಲ ಮೇಡಮ್ ಅಂಡ್ ಶುಭಮಂಗಲ ಮೇಡಮ್, ಶಕುಂತಲಾ, ಆಲ್ ಮ್ಯಾಮ್. ಈಗ ಒಂದು ನಮ್ಮ ಹತ್ರ ಕೇಸ್ ಬಂದ್ರೆ ವಿ ವಿಲ್ ರೈಟ್ ದ ಕಂಪ್ಲೇಂಟ್ಸ್ ಅಂಡ್ ಪ್ರಕೃತಿ ಅಂಡ್ ಆಲ್ ದೋಸ್ ಥಿಂಗ್ಸ್. ಯು ಪ್ಲೀಸ್ ಗಿವ್ ಸಮ್ ಇದು ಲೈಟನಿಂಗ್. ಓಕೆ ಮೇಡಮ್, ಥ್ಯಾಂಕ್ ಯು. That is my request.
If I join, definitely I'll help, because every week some program or something is there. If at all I can come, I'll help if I know.
ಅಂದ್ರೆ ಈಗ ನನ್ನ ಪ್ರಾಬ್ಲಮ್ ಏನಂದ್ರೆ ಒಂದ್ ಕೇಸ್ ಬಂದಿದೆ ಅಂತ ತಕ್ಷಣ ಆ ಸಿಂಪ್ಟಮ್ಸ್ ಎಲ್ಲ ಕೆಲವಾಗ ಎಲ್ಲ ಮೆಡಿಸಿನ್ಸ್ ಒಂದೇ ಸರಿಗೆ ನೆನಪಾಗುತ್ತೆ. ಸೊ ನಾವು ಅದನ್ನ ಹೆಂಗೆ ಬೈಫರ್ಗೇಟ್ ಮಾಡಿ ಯಾವ್ದಕ್ಕೆ ಇಂಪಾರ್ಟೆನ್ಸ್ ಕೊಟ್ಟು ಯಾವ ಮೆಡಿಸಿನ್ ಸಜೆಸ್ಟ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದನ್ನ ಅಡ್ವೈಸ್ ಬೇಕು ಅಂತ ಇಷ್ಟಪಡ್ತೀನಿ.
ನೀವು ಔಷಧಿನ ಅಭ್ಯಾಸ ಮಾಡಿ, ಯಾಕಂದ್ರೆ ಅದು ನಮ್ಮ ದೃಷ್ಟಿ ನಿಮ್ಮ ದೃಷ್ಟಿ ಬೇರೆ ಅಲ್ವಾ. ನಾನು ಎಲ್ರಿಗೂ ಹಾಗೆ ಯುಕ್ತಿ, ನೀವು ದೋಷ ಯಾವ್ದು ನೋಡಿ ಆ ಔಷಧಿನಲ್ಲಿ ಯಾವ ದೋಷ ಹರ ಇದೆ ಆತರ ಮಾಡ್ಬಾರ್ದು ಅಂತಲ್ಲ. ಹಂಗೆ ಮಾಡ್ತಾ ಮಾಡ್ತಾ ನಮ್ದೇ ಒಂದು ಕಾಂಬಿನೇಷನ್ ಬಂದ್ಬಿಡುತ್ತೆ. ದ್ರವ್ಯಗಳು ನೋಡ್ಕೊಂಡು ಅದ್ರ ಮೇಲೆ ಇದು ಮಾಡ್ಬೋದು, ಯಾವ್ದು ಹರ ಇದು ಅಂತ, ಯಾವ್ದು ದೋಷ ಇದಾಗಿದೆ ಅದ್ರದ್ದು ಹರ ದ್ರವ್ಯ ಆತರ ನೋಡ್ಕೊಂಡು ಟ್ರೈ ಮಾಡಿ. ನಾವು ಮಾಡೋಣ, ಎಲ್ಲರೂ ಮಾಡೋಣ. ದಟ್ ಇಸ್ ಬಟ್ ಜಸ್ಟ್ ಅ ಸಜೆಷನ್.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಥ್ಯಾಂಕ್ ಯು.
Thank you, ma'am. Thank you so much for your input. So let's wind up the session, ma'am. Thank you for being here for the wonderful session, ma'am. Thank you all and have a good day.
Thank you. Good night, everyone.
Thank you all, ma'am. Thank you very much, Shubhakala ma'am. Everyone, thank you. Good night.
Bye.